Hi, my name is Laura Trevorrow, and I'm going to be a senior at Stowe Monroe Falls High School, and I was in the Science Internship Program for Nursing, and I worked with Kimberly Navratil in Nursing Administration, and the title of my project is A Retrospective Study of Characteristics Exhibited by Nursing Home and Long-Term Acute Care Hospital Patients Diagnosed with Sepsis and Readmitted to Acute Care Hospitals within 30 days of discharge. Nursing home and long-term acute care patients have a greater chance of developing dehydration due to sepsis. Dehydration occurs when there is not enough fluid in the body. Often, many nursing homes and long-term acute care facilities do not adequately measure their patients' input and output. Therefore, many of these patients are dehydrated and are left untreated for many hours, allowing the urine to become highly concentrated and cause sepsis. Also, many nursing homes and long-term acute care facilities do not monitor the intake of fluids from PEG tubes. PEG tubes deliver nutrients, fluids, and medications directly into a patient's stomach. This goes beyond the control of an elderly patient who is unable to feed or drink by themselves and needs the assistance of a skilled nursing professional who would be able to help provide for the patient after he or she has been released from the hospital. The elderly should be monitored the most because their immune systems are compromised from older age, and they also do not drink enough fluids to keep them hydrated. As a result of inadequate monitoring and the inability to intake fluids, many elderly nursing home and long-term acute care facility patients develop dehydration due to sepsis, which cause them to be readmitted to the hospital within 30 days. What will I be researching? Many nursing home and long-term acute care facilities have been sending patients back to the hospital within 30 days because the patient is septic. Hospitals are going to be fined for every readmission within 30 days, and will an advanced practice nurse located in nursing homes and long-term acute care facilities help lower the amount of readmissions within 30 days? Readmissions within 30 days cost hospitals millions of dollars every year. The Medicare Payment Advisory Commission, or MedPAC, has estimated that 20% of all readmissions into hospitals within 30 days cost Medicare about $17.4 billion a year. Also, MedPAC has concluded that about 2/3 of all readmissions are avoidable. MedPAC has recommended penalizing the hospitals that continually have high readmission rates. This could cause hospitals to rethink sending an advanced practice nurse into the field to prevent these readmissions. The APN's salary would be nothing compared to the cost of the readmissions. There is my abstracts. My hypothesis was most nursing home and long-term acute care patients will have common demographics greater than 3 comorbidities and lab values which demonstrate signs of dehydration and sepsis, which all contribute to a less than 30-day readmission. Advanced practice nurses rounding, educating, and operating in direct collaboration with nursing home staff will result in early identification and intervention to nursing home patients, which will reduce acute care hospital less than 30-day readmission rates related to sepsis. For this research project, the researcher looked at a retrospective chart review of patients readmitted in less than 30 days with a diagnosis of sepsis. 36 patients were determined from UHC data reports of the top 3 readmitting skilled nursing facilities, A, B, and C, and were observed over a 12-month period. The data that was collected was based on demographics, comorbidities, lab values, and general data related to readmission. The data shows that most of the 36 patients were 60 years or younger and between the ages of 66 and 70. Also, out of the 36 patients, 18 of them were female and 18 of them were male. This data shows that out of the 36 patients, 14% or 5 people were Caucasian, and that 86% or 31 people were African American. Also, there were 3 nursing homes in this study, A, B, and C. 16 patients came from nursing home A, 12 patients came from nursing home B, and 8 patients came from nursing home C. The 5 main comorbidities that were looked at were pneumonia, renal failure, diabetes, anemia, and congestive heart failure. 72% of the 36 patients had 3 or more comorbidities. These comorbidities can weaken the immune system and increase the likelihood of infection. BUN stands for blood urea nitrogen. When the level is high in the body, it can be a signal that there is possibly an infection in the urinary tract. When sodium levels are high, it is a clue that the body is dehydrated. White blood count, or WBC, shows how many white blood cells are in the body. When the level is high, it is a clue that there is a possibility of an infection in the body. Results. The results of the study showed that most patients were readmitted on either a Sunday, Monday, Tuesday, or Saturday, with the least being readmitted on either a Wednesday, Thursday, or Friday. A reason for the majority of patients being readmitted on a Sunday, Monday, Tuesday, or Saturday could be that either the doctor was not working or was on call, so he or she was not able to evaluate the patient and sent the patient directly to the hospital. The correspondence between the length of stay and the number of days before readmission is that 56% of the patients stayed between 7 to 14 days, and that 53% of the patients stayed out of the hospital for more than 14 days. With the results of the data, recommendations for decreasing the number of readmissions for nursing home and long-term acute care patients diagnosed with sepsis should include the help of an advanced practice nurse in the nursing homes and long-term acute care facilities. Advanced practice nurses rounding and educating at the nursing homes and long-term acute care staff will result in early identification and intervention to nursing home and long-term acute care patients. There are my references. And I'd like to give a big thank you to my mentor, Kimberly Navratil, and to Mike Kecken for providing the UHC data, to Linda Pasick, Carol Weber, South Point Hospital, and the Cleveland Clinic Office of Civic Education Initiatives. Thank you.